Alright, so today I'm going to do an arterial blood gas draw. So always before I go into the room, I need to check the patient's charts to see if they're on any anticoagulants, anything that could cause the bleeding to continue if I need to hold longer on the site. So once I am ready, I always take in a kit with me. I need to do an ABG kit with me. And then I would always knock on the door before I enter the patient's room and introduce myself. So once I'm done introducing myself, I always check the ID band before I do a blood draw especially. So once I am ready, so I'd always wash my hands, dry my hands, and then apply the appropriate gloving on before I begin to help out the patient. So as always, you want to do your pre-vital signs, especially like you want to get their temperature before you draw the blood. And once you have that done, then you can begin with the procedure. But you always want to give the patient an understanding of what you're doing, that it's a different blood draw. So today I'm doing an arterial blood gas draw. That's just to see what your oxygen level is and making sure that you're getting the appropriate amount of oxygen to your lungs. So that is going to be taken from your wrist. It's going to be taken from an artery and not from a vein. So I am going to take it from here. So I'll be taking it from your radial. So before I take any blood draw, I always need to do a modified Allen's test. So when you do a modified Allen's test, you have the patient do a fist 3 times and have them open to see what their skin flushes back to. And when doing the modified Allen's test, you want to occlude the radial and ulnar arteries, and then when they do the fist after the 3rd time, you would release the ulnar artery, and then you want to see what their blood flow is and see if their skin color comes back in within 3 to 5 seconds. If it does not, then you have to do the other arm. You always want to try to get it on the non-dominant arm. So then you check the other arm if the blood flow isn't good on the other one. So then you check it again and have them do the fist 3 times and check it. And once you find the arm that has the best flow in it and is okay, then you want to get the pulse, figure out, you want to palpate the radial artery and make sure you find the pulse. So once you're ready, then you can get your alcohol prep wipe. You always want to clean it off before you draw blood. So you want to do it in circular motion, get a good area clean so that way it doesn't get infected. And so then once you're done, you dispose of your alcohol prep wipe, and then you want to dry it and make sure it's dry before you stick a needle in so it doesn't cause any burning or anything like that. So once you are ready, you get the needle ready and make sure it's always at the appropriate setting that you need for the blood draw. So when holding the needle, you always want the bevel up when you do the blood draw, and you also want to hold it at a 45-degree angle. And for like a blood draw, you want to have them extend their arm out like this, but you would also need to have like paper towels or something underneath it to hold or extend their wrist out. So assuming that I have the wrist out extended, I always want to find the pulse again, make sure I find it. And when I'm ready, I can slowly move my finger away and stick it into the patient, and then you should start to see blood go up into the needle here. Okay, so it'll fill up the tubing, and when you're done, you want to make sure you have gauze ready to go, and you want to hold very carefully not to stab yourself and hold down the site, and then you would put it into the stopper here and you'd push down the needle into the stopper like that. Now, assuming that you don't have, I don't want to push it in. So when I'm done, I would remove the needle. Always remove the needle before I do the deal, and I'd place on a stopper. So the stopper will help get rid of any clotting, help from any air bubbles that may be present in the blood sample. So always place a Band-Aid over this. Now, if the patient is on an anticoagulant, you might have to hold more than 15 minutes. And if that's the case and you cannot leave the patient's room, you can put the blood sample on ice if you need to, if you can't get the blood sample there right away. So when I have that, I always want to make sure I tell the patient to leave the Band-Aid on for more than 4 hours, just so that way we don't have any infection and no causes of bleeding after the draw is done. So when preparing the blood sample for the lab, you always want to make sure you have the label ready, like have the patient's name, their temperature, the room number that they're in, the date that I did the test, what test that I did, and the time that I did it. And then here is the ventilation. So if the patient is on oxygen, you always want to get their FiO2. If they're just on room air, you just want to put down the 21%. So as always with your blood sample, you put your blood sample into here, into your biohazard bag, and then you would stick the label at the top so that way when it gets to the lab, they know what patient they have. And as always, you always want to get rid of the needle with the stopper into a sharps container. And when I'm done, I want to make sure I have everything clean. There's no blood anywhere. And then I would remove these gloving. Then I would wash my hands, dry them, and then apply appropriate PPE again. And I would reassess the patient and get their post vital signs to make sure their everything is looking good. If they were on oxygen or anything, I need to make sure that the oxygen device is set at the appropriate flow that it needs to be at, and they're getting adequate oxygen. So every time I do anything with a patient, I always want to go and chart everything that I have done for the patient.